Well, Jay Sekulow of the American Center for Law and Justice is here with us to talk more about this bill. Jay, you've gotten into the guts of it.
Yep.
Last night you sent me a briefing memo, and I'm now suddenly very concerned about page 424 in section 1233.
You know, because this is one of those sections, again, that when you've got this comprehensive bill that no one's read, that now they're finally starting to read, because groups like ours are starting to get into the details of it. We've read the whole bill a couple of times.
Well, this thing could have been passed already. That was the original
plan. I mean,
right.
Gord, they wanted it. You know, the one good thing that's happened is that this debate has now taken place and it's slowed down, but they were trying to get this through before the recess. But here's the end-of-life care decision problem. Look, all of us are faced with end-of-life decisions. I mean, I've just gone through to my own family. You have to make decisions. You want to be in consultation with your family and your doctors. What you don't want is a federal panel determining what that should be for you. And then what makes this more complicated is you've got these mandated decisions that have to be made, and the government is then getting a report from the physician basically saying, were you successful in arranging for these end-of-life decisions, whether it's a do not resuscitate, whether it's not unreasonable care to be given, whatever it might be. There's a seven-part analysis.
The last, you know, there are 7 parts here that are essentially mandated in this conversation.
Right.
That the physician is required now to have, and you know, will get reimbursed for it. But the puzzling part to me is, why does the federal government need that kind of detailed information about the patient as to what they elected to do?
Because they're trying to save money through this health care reform. That's what they keep talking about. What's the best way to save money? Well, the end-of-life care is expensive. If you can eliminate the cost of end-of-life care, and you have the doctor in the white coat sitting there with the patient, maybe the family there, maybe not under HIPAA, that depends on the privacy laws, and they're trying to get you to sign the document. I mean, the idea here is not just to inform you, but to get action taken. And then the government, who's giving a reimbursement to the physician for this care, is saying, we want to know, were you successful in arranging this? That's the checkoff on the economics. Now, people are saying, well, no, calling them death panel is not fair, that's not right. But the fact of the matter is, we've got a Washington bureaucracy that's going to be determining the care for the individual, end-of-life care for the individual, not the doctor in consultation with the patient in a tight, intimate relationship. You've now got the federal government intervening. That is a very, very dangerous thing.
Let's talk about the other provision that is causing concern, particularly to Christian groups, and that is, if you have insurance, and you're a Christian organization, you have health insurance for your employees, you will now be mandated to provide for abortion coverage.
That's because under the law, the way it is written, and there were attempts to amend it to get it out, but those were not successful. The law says there's going to be certain primary benefits that have to be covered. Reproductive choice, that's how they phrase it, is one of those that have to be covered. Not only in the public health care, in other words, Medicare, Medicaid, but now in private health care, that will be a mandatory situation. What complicates it is there were 2 amendments put forward by the way, bipartisan, Republicans and Democrats, saying that that provision should be removed. We're not going to have mandatory abortion services in health care, especially when you've got religious organizations, not the Catholic Church. I mean, to have this as part of their health care requirement. Those failed by a 12-13 vote. 13 to 12, it failed by a vote. So as the bill sits right now, there is a mandatory abortion mandate in this bill. Yeah, I've said this. The fact of the matter is, this is the Freedom of Choice Act.
That the U.S. Congress would dictate to the Roman Catholic Church, would dictate to groups like CBN.
Right. Southern Baptist Convention. Sure.
Focus on the family. You name it. You're a Christian organization. You got health insurance for your employees.
Mandatory.
And now it's mandatory that
abortion service is covered. No religious. You know, you're a lawyer. No religious exemption here. We need to be clear on that. There was some talk about, well, the Hyde Amendment might cover it. Number 1, the Hyde Amendment doesn't cover private health care insurance. Number 2, they have the votes to undo the Hyde Amendment, which is up every year. Right now, it could be gone today. So the fact of the matter is, both private health care and public. It was bad enough, you know, people said, I don't want my taxpayer dollars going to abortion services. Now it's a step beyond that. It's as the employer of a law firm that is a Christian organization, are we going to be mandated to have in our coverage for our employees, in the manual, reproductive choice services, abortion? And the answer to that, as the law is right now, is yes. That is in there.
The main protest seems to be focusing more and more just on the overall cost of this. That we're looking at an extra $1 trillion into the budget. Is that an accurate figure? Or
I think
do we even know?
It's always low. The fact of the matter is, we look at any government program. I always tell people this. Look at a government program. Tell me which one's being administered correctly and on budget, and you can't find one. This is a down payment on a disaster, not just from the moral and spiritual implications and from a policy standpoint, but from a fiscal standpoint. It makes absolutely no economic sense to engage this. You know, we have problems in the healthcare system. There's no doubt about it. Meanwhile, we have the best healthcare system in the world. You don't hear of many people leaving the United States and going to France or Germany for healthcare, but you hear a lot of people from France and Germany that can afford to come to the United States, coming to the United States for healthcare, including kings and prime ministers. So that should tell us something about our system. We don't want to model a system after Canada. That's precisely where this is going.
Where can people get more information? There seems to be a lot of misinformation, disinformation. Where can people get accurate information?
We are posting on our website at aclj.org a constant analysis, not just of these provisions, but others as they come up. There's also, Focus on the Family has information up, so I encourage people to go there, but aclj.org. I know you've been covering on cbn.com. The fact of the matter is the White House also has a website, and I encourage people to go to the whitehouse.gov website. You know, they're right now saying if you get an email that's fishy, we want you to flag it, send it to us, and we're going to keep a database. I mean, they say, well, we're not going to keep a database, but then they say, well, we are required under federal law to keep a database. But, you know, thousands of people are flagging basically themselves, sending the flagging information in to the White House in a protest. They're trying to stifle, you know, they try to get it through the House and the Senate without a debate. They tried to then stifle the free speech discussions in the town hall meetings and then saying report your friends when you get an email you don't like. Really sounds Soviet Russia-like as far as the way they're trying to control the speech. But frankly, the White House has lost control of this issue. I think that these 2,000 and 3,000 people showing up at these town halls tells you a lot. The American people are not sold on this and do not want this rush down their throat. Well,
I couldn't agree with you more. No, please do not. You know, if you stampede this one through, boy, I can just see the court cases stacking up on the other side of that, and then we're going to be dealing with a mess. We got some ready already. Just trying to figure out what's going on with it. Yeah. Get informed. Go to aclj.org and get informed about this, and let's have a vigorous debate over these issues. Do we really want to require religious organizations to pay for abortions as part of their health coverage? Do we really want some kind of government panel getting reports about end-of-life discussions between physicians and their patients? Do we really want to pay the ultimate cost of this? So get informed. Go to aclj.org.